We're going to show now a series of cast corrosions which demonstrate the connection of the veins inside the kidney with those that surround it. In this case, you can see the left renal vein that connects with the veins surrounding the proximal ureter. Also note that there is a vein around the lower pole of the left kidney and other veins close to the medial aspect of the upper pole of the left kidney. This is a close-up showing numerous veins that cover the renal pelvis. Note that there is a large venous channel that is connecting the lower pole of the kidney with ureteric veins. Also note the large size of ureteric veins in the proximal third of the left ureter. Tomographic examination may reveal some of these veins, which course in the perirenal fat as indicated by the arrows. These veins do not indicate that the patient has renal vein thrombosis or that there is a hypervascular mass. They may simply represent anatomic variations of the perirenal venous plexus. A close-up of the hilus of the kidney. Note the different sizes of veins that are in contact with the renal pelvis and the ureter. Some are very small, some are very large. When there is expansion of this venous plexus as a result of flow diversion into these veins as a consequence of renal vein thrombosis, there may be notching or filling defects in the renal pelvis and or ureter. This is a close-up of the proximal third of the ureter. Note the large size of periureteric veins. It is easy to understand the vascular notches seen as a result of expansion of these veins, and this is seen usually as a manifestation of renal vein thrombosis. Also note the connection of these periureteric veins with a large vein that is connected to veins within the lower pole of the right kidney. In some patients, the periureteric veins are fewer in number but larger in caliber, as seen in this case. And note that there are two large veins paralleling the proximal third of the ureter. Note that this large periureteric vein that wraps around the proximal third of the right ureter. When enlarged, it is easy to imagine a large notch. The venous notches are broader and less permanent than the arterial notches, which are smaller and more permanent. In this specimen, the large vein that parallels the left ureter is the left gonadal vein. And this vein, when it distends, it is so far away from the ureter that normally we do not expect any notches from expansion of this vascular channel. This is a cast only of the veins of the right kidney. Note the free communication between the intra and extra-renal veins. Also note that the extra-renal veins communicate freely with the veins that are in contact with the renal pelvis and adjacent to the ureter. This is a close-up of the same specimen where we can see the periureteric veins connecting with the renal vein and with those of the lower pole of the kidney. After removing the kidney, we can see the envelope of veins adjacent to the kidney. They connect with the main renal vein with the veins of the renal pelvis and periureteric veins. In this specimen, we can see abundant communications between the veins of the adrenal gland with the main renal vein and with perirenal veins adjacent to the upper pole of the kidney. This direct communication of the adrenal gland with the renal vein is the most frequent pattern observed as far as the venous drainage of the adrenal glands and is seen on the left side.